Okay, I think we are live now. So, very good afternoon to everyone. I'm Dr. Sandeep Sharma, Pediatric Faculty for NEET PG, FMG, and NICT at DocTutorials. And it is my pleasure to invite one of the toppers in the recently held FMG exam. Dr. Manisha Chaudhary is with us. Manisha has got score of 241, a score people only dream of. So she is living her dream, and it's my pleasure to invite her to this interview. So, Manisha, first of all, congratulations and welcome to this interview.
Thank you so much, sir. It's my pleasure to be with you and give this interview today.
Manisha, first of all, please tell about your background and then we can continue.
Yes, doctor. I have completed my MBBS from Vinnytsia National Medical University in Ukraine, and
Mhm.
this was my first attempt, and I got a score of 241 in this attempt.
And
Yes.
241 in your very first attempt means your basics are very strong and most of the decisions you have taken regarding your preparation are spot on. So, Manisha, first of all, how was your analysis of the exam? Was it easy? Was it tough? Was it clinical? A lot of people after the exams were very skeptic about paper one, especially. What is your opinion overall of the exam and what did you feel after giving the exam?
So I felt like paper one was on moderate level. It was not that difficult. There were some straight questions also in paper one, and paper two was majority clinical. And if you had your concepts clear, the paper was very easy. Like if you had your concepts or you were studying the concepts and you had your base clear, the paper was very easy. And there were a lot of questions which were repeated from PYQ and PYT, but in a different way. Like they were not straightforward. They were like twisted in a way, or some images were twisted or some options were twisted. So I think it was a little bit tricky, but if you had your concepts clear, it was an easy paper, sir.
Absolutely. See, many students who have given the exam, and after the exam, the reflex was it was a tough paper and there were very few PYQs. Manisha is also saying the same. I took a couple of other topper interviews also, and I sat with two of my colleagues also who we analyzed whatever incomplete recalls we had, and we realized PYQs were more than 120 to 130 out of 300. It is just
Yes,
that
sir.
they were twisted. People were expecting is similar same thing will be asked with similar options, just that they were applying. You needed a bit of presence of mind and of course good clinical skills, which Manisha obviously has. Manisha, what about DocTutorials? Did you use DocTutorials and did you find the
Um,
resources and the clarity amenable to your preparation?
yes, sir. DocTutorials was very helpful in my journey. For example, I started from your notes for pediatrics, which was very helpful and very straightforward. They have helped me a lot. Like in the last time, especially when we were supposed to revise only the main things and only the topics from which the questions were focused. That was your notes were very helpful, and also in different subjects like microbio from Sonu sir and ENT by Dhawan sir, and also Dharma by Pallavi ma'am. The notes and the materials and the videos, everything was superb. It has helped me a lot in my last time during this journey, and I'm thankful to Doc Tutorials for this amazing score which I had today.
Lovely, lovely to hear that. It's always, bit fills our chest with pride listening that our efforts are bearing some, they're bringing results for and helping you out. So, Manisha, would you be recommended DocTutorials to your juniors?
Definitely, sir. Definitely. Also, like for the study material, definitely, and also for the motivation you guys provide. It's amazing. Like you put in so much work and also so much positivity into the students, and especially during the last 6 months when everyone has that stress going on of exam pass aa exam pass aa You guys were like uh, trying to keep the children like calm and composed and to focus on their studies. That was amazing. That has helped me a lot. Like to keep my mind calm.
Great. Manisha, there will be a lot of students, a lot of your colleagues, juniors, seniors probably, who have not done well, and they will be appearing again in July exam. Your suggestions, things to do and things not to do. What you feel?
Doctor, I would suggest them like for not taking the shortcuts. I would like seriously they need to like work on the concepts more, practice MCQs more daily, give GTs more frequently whenever possible, and to analyze their mistakes. the biggest role is analyzing the whole GT thing and analyzing which, like, for the subjects which I am weak in. I know that I'm weak in this subject. I have to work on this subject and not skipping the subjects. Like, don't even skip the subjects. For example, if you don't like one subject, at least do its PYTs or previous year questions and do something. Like, do not leave it, because you may never know like which subject has the majority of questions in exam. So that is, and also I would like my colleagues or peers to follow this doc tutorials and to do all the videos comparatively in a good way, and to repeat the
Great.
revision again and again and again, like two, at least 2 or 3 times.
Okay. So to summarize, what Manisha is saying is get your basics right. Do not take too many shortcuts. At the same time, practice MCQs, multiple revisions, and staying focused. I think if you do all these things, if even 5 months time for those who are targeting the July exam should be enough. Manisha, this success would not have been possible without the support of family, friends, and other people in your life. Would you
Yes.
like to give any shout outs to people who played
Yes.
this role in your success?
Doctor, my family has like supported me very well during this whole time. They have like been a backbone, and also to my teachers and like colleagues who have trusted that yes, I would be able to get a good score in the exam. They have played a major role, Doctor.
Great, great, great. So, on behalf of DocTutorials, Manisha, we wish you all the very best. And my personal advice is you have tremendous potential. Keep up the momentum, don't let it go. Internship, develop clinical skills, become a good clinician, become a good doctor, and also target PG entrance exam, because same things, just a different way of asking. More extensively they are going to be asked, but the rules are going to be the same. And I hope 1.5 years later I'm taking your interview again on this channel when you have cracked PG entrance exam. So wish you all the very best on behalf of the entire doctorals team.
Thank you so much, sir.
Thank you, Manisha, it's been a pleasure. Thank you so much.